Up to 20% of small renal masses are benign in nature. The diagnostic accuracy of currently available imaging techniques in differentiating benign from malignant neoplasms in this setting is still suboptimal. While still labelled as under investigation by the EAU guidelines, technetium-Sestamibi SPECT-CT has shown promising results in discriminating such neoplasms. This systematic review and meta-analysis aim to evaluate the diagnostic accuracy of technetium-Sestamibi SPECT-CT in characterizing indeterminate renal masses by discriminating renal oncocytoma and hybrid oncocytic chromophobe tumor from all other renal lesions, all malignant renal lesions, and versus clear cell and papillary renal cell carcinoma, with the latter being a secondary endpoint. A literature search was conducted including both prospective and retrospective studies where Sestamibi was compared to histology after renal mass biopsy or surgery. Overall, 8 studies comprising approximately 500 patients were included. Regarding the primary endpoints, sensitivity and specificity of Sestamibi for renal oncocytoma and HOCT versus all other renal lesions were both 89%, with the positive and negative predictive value of 63% and 98% respectively. Secondly, renal oncocytoma and HOCT, when compared to all other malignant renal lesions, showed a sensitivity and specificity of 89% and 91%, with the positive and negative predictive value of 66% and 98%. Regarding the secondary endpoints, notably for renal oncocytoma and HOCT versus clear cell and papillary renal cell carcinoma, Sestamibi shows a specificity of 98% and a sensitivity of 89%. Now, with a high risk of bias and significant presence of heterogeneity, the level of evidence is still low. However, to conclude, Sestamibi has good sensitivity and specificity in differentiating renal oncocytoma and HOCT from all other renal lesions, in particular those with a more aggressive oncological behavior. Despite these results are promising, further studies are needed to support its use outside research trials.